Please welcome our first guest, Dr. Peter Kane. Dr. Kane, thank you so much for taking time out of your day today. I know how busy you are.
No, it's my pleasure.
We appreciate having you here. I like to introduce my guests to the community. So
Sure.
tell me a little bit about yourself, your education, your background. What
Sure.
have you.
Well, I grew up in New York in Westchester County, just outside of New York City, and went to medical school there at New York Medical College. And after that, I went to Miami my wife and I went to Miami for 5 years, where I did my general surgery training at the University of Miami Jackson Memorial Hospital, which was busy and exciting.
I bet.
And then in 2003, we moved to Charlotte for my cardiac surgery training under Dr. Robercheck at the Carolinas Medical Center.
Yeah,
Yeah.
that's great.
Wow.
Great.
Seems like it was yesterday, but.
Well, speaking of yesterday, how long have you been here?
So we came to Wilmington in 2006, summer 2006. So what's that about?
Does that make you a local or not? In Brunswick County.
You got to ask the local. I don't know.
In Brunswick County, I've been there 23 years, and I'm still not a local.
Well,
So, I don't know how long it takes.
Probably not, but I'm trying.
So, tell me, how did you get into heart surgery? Was that always your dream?
Well, I really always was interested in surgery, and actually, when we went to Miami, my thought was that I was going to be a trauma surgeon. I went there because it was a super busy trauma center, but it got exposed to heart surgery very early on, and it really had a big impact on me from the beginning. Just the technical aspects of it, and also there's a satisfaction in seeing patients really get well, and that was one of the most rewarding things that I saw about heart surgery, is that you did an operation and somebody got better and felt better, and so that was sort of it from the get-go.
Oh, that's great. That's a great story. Okay, I want to get a little bit more specific. So let's talk about coronary artery disease.
Sure.
How does that affect patients? What would be this?
Well, typically coronary artery disease is really, try to break it down to, in its simplest form, is really a plumbing problem. You have arteries that are delivering blood flow to the heart muscle on a constant basis, and when they're obstructed by plaque or thrombus, the delivery is insufficient, and so that can be either a subtle thing that's growing over time, or it can be an acute thing like a heart attack that brings you to the emergency department. So we deal in coronary artery disease in terms of reconstructing it. There's lots of different ways to approach that problem. We're sort of the end of the line, if you will.
I was going to say, so by the time it gets to you, it's surgery.
Typically, yeah, and typically we see people who have already been through the process of, hopefully, it begins with a discussion with their primary doctor and a nice slow workup with their meeting a cardiologist and getting a series of tests. But typically, by the time they see me, they've been diagnosed with multi-vessel coronary artery disease, meaning typically more than one or two arteries are blocked.
How about valvular heart disease?
Sure,
is that similar, or is that?
It's very well. It's similar in that it's. The heart valves are an essential component of cardiac function. They perform a slightly different job. They're really controlling the pathway of blood flow from the inflow into the right heart to the lungs, back to the left heart, and back into the primary pump, the left ventricle, and separating the left ventricle from the aorta. So there's 4 primary valves in the heart. We typically tend to intervene in one way or another on 2 of them. We have an integrated program here, a structural heart program that really looks at valves in detail and tries to find the right pathway for patients, whether it's the least invasive or percutaneous options, where we're replacing an aortic valve on a catheter, or some of our colleagues like Dr. Lewis is putting a clip on a mitral valve to direct the blood flow properly. Or we decide that the best option for the patient is surgery, and sometimes there's multiple reasons that surgery may be a better option than a percutaneous approach, and there's many times that a percutaneous approach is more ideal to a surgery, and we just try to tailor the right approach for the right patient.
There are many surgical techniques or procedures done here at Novant Health, New Hanover Regional Medical Center. What's the most common type of heart surgery here that you or Dr. Marks?
So Dr. Marks and I do, our most common operation is coronary bypass surgery. Yeah. He and I have been dedicated to doing what is referred to as total arterial bypass, which is we use arteries to replace arteries or fix arteries, and in most cases we're using at least 2 or 3 arterial bypasses. In the past you may have been familiar with using an artery from the chest and some veins from the legs, and in the last 5 years we've really steered towards total arterial bypass, and most of our patients are receiving that. The reason we do that is because the arterial bypasses tend to have better longevity over a long span of time, and so we think that's a big benefit for patients. Also, not going into patients' legs as frequently anymore has been a big bonus, and that gets people up moving faster and sort of takes that element out of it.
Yes, yeah. I wanted to talk to you about heart attack prevention. That's a biggie. I know diet. I'm always talking to my husband about stuff like this, but I'm sure you would rather operate on a person who's never had a heart attack or before they're in the throes of one. And let's talk about how to have a healthy heart. How do we keep from getting to need you?
Okay, well that's a long that's a long question, but in general it's a lot of common sense, and really healthy lifestyle is very important. And number one is removing environmental risk factors, which are the primary one we see is obviously still, believe it or not, tobacco abuse. We still see tons of people that are still smoking. Diabetes is a big one, and diabetes is and diabetic control is super important, and working with the primary doctor to make sure that your blood sugar is tight is a very important component. Finally, exercise and diet is a very important component, and there's more and more evidence, and I won't go into the details, but there's more and more evidence of a plant-based diet being a very important component of risk reduction for coronary artery disease. And we have an excellent program here, the Ornish program that the hospital has developed along with the Ornish folks, and it's a great program that goes over all of those things: lifestyle, risk reduction, diet, exercise.
Well, there's just so many more questions, but unfortunately we're out of time. I appreciate you being here. It's been a pleasure, my pleasure to have you here, and I hope you'll come back.
It's my pleasure.
Come back to Wilmington.
I'd love to come back anytime.
Okay, you just pick the topic.
Sounds great.
Great, thanks so much.
Thank you.